relevance where very less experts in India on this topic, and it is on scope of diplomacy in public health. And Professor Dr. Joe Thomas is very known to the public health community, especially global health community. And but it is my duty to introduce him. And first of all, I want to inform to all the participants here that he's the one who started the Department of Public Health at MIT World Peace University in 2019. And last 5 years, this course is continuing, and he's the one who has introduced this, and our students are contributing to the public health research and advocacy in India and outside India. And for the other new students of MIT WPU, I'm myself Dr. Vanishri Ramanathan from the Department of Public Health, MIT World Peace University. All our first year and second year Master of Public Health students are joining. And let me introduce Professor Dr. Joe Thomas, sir. He's a public health expert, and we know that he's writing and he's giving sessions and lectures on different areas of public health. And he's currently the Editor-in-Chief of Critical Public Health and also Director of AICHM, based in Melbourne from Australia. He's joining us from Australia. Also chairing the Global Public Health Sustainable Policy Solution Foundation. And for all of your information, he is also a Research and Recognition Committee member and Board of Studies member of Department of Public Health at MIT World Peace University. So we warmly welcome you, sir, for this session, which is very, very relevant for our students. And this is one paper which second year students are also taking. So your valuable insights and reflection is very, very useful or beneficial for our students. And without any further delays, over to you, sir, Professor Dr. Joe Thomas, sir. Over to you, sir.
Thank you very much. Good morning and good afternoon for some people. And I really thank you for all the compliments, much appreciated. And it's a special privilege for me to talk to the students from MIT World Peace University and the School of Public Health, because I was part of the team which created the school. So it's a privilege and it's a great honor to come back and talk to you about health diplomacy. Next slide, please. Next slide, please. Yeah, and again, thank you to this fascinating subject of global health diplomacy. And it's an extending and evolving a new area of global health. So those who are interested in global health, this subject will be much more of relevance and importance. So I particularly thanking all of you taking your time to join this session. Next slide, please. What I want to talk to you today is today's slides. I have about 30 slides. So I may take about 30 minutes. I may give a brief introduction on what is the objective of this session. I'll try to give different definition of health diplomacy. What's the role of a global health diplomacy in global and national public health, how that is fit into the global health and national health? What themes and how they are being negotiated worldwide in the context of a global health diplomacy? What are the key institutions, key agencies, and what are their role in the diplomacy? The venues in which the health diplomacy is practiced. And briefly, I'll mention about the pandemic treaty that some of you may be aware of it. And also, I look at an overview of different government effort towards health diplomacy. So this is the main overall objective of my session. Next slide, please. And I just wanted to focus on the learning objective of this session. Number one learning objective is to introduce you to the concept of global health diplomacy. That is one of the learning objectives. By attending this session, you will have some idea about the concept of global health diplomacy. And I'll introduce some of the key players in the global health diplomacy, the diplomacy practice. And I'll look at the issue of the arena. I'll introduce you to the health diplomacy where it is practiced. And the third is about the introduction of the process of agenda setting at the global health level and the agenda setting at the global health diplomacy. And also finally, I'll give some reflections about my own experience. I had an opportunity to work as a global health diplomat for about 6.5 years. So my personal experience, I'll be sharing how that is being practiced and from the field experience of global health diplomacy. So this is the learning objective of today's session. Next slide, please. And when I mentioned about my personal experience of practicing global health diplomacy, from 2012 to 2018, I worked as a senior intergovernmental diplomat, focusing on population policy and health. Based on this extensive experience, at the end of the session, I'll share my personal experience. Next slide, please. Now let's look at what is the relevance of global health diplomacy. Many of you may ask, how global health diplomacy fit into the public health, and in where it is going to, how you're going to place this, and how this is related to the sustainable development and health. The global health governance relevance. There are socioeconomic development and health. This is another relevance. And alleviating the global health inequities. This is another area of possibility of global health diplomacy. And when you look at trade and global health, and also trade-related services, research collaboration. So these are some of the broader areas of the relevance of global health diplomacy. I'll elaborate on these issues in my coming slides. When you look at the relevance is coming from the challenges of the globalized health. And the health is being globalized. The health in a rural village has got implication at the global level, and some of the global health issues got implication at the rural level. And if you look at the pandemics, antimicrobial resistance, impact of climate change, so this all threatening the global population as one unit. So these challenges are not necessarily as one country's challenge or one region's challenge. These are becoming a global challenge. And also, there is a need for, there is an increasing understanding. So we need to have a collaborative effort to achieve health security and equity, and it cannot be achieved by one country alone. It needs to be a global at different countries, bilateral and intergovernmental multinational effort is needed to address many of the emerging and re-emerging public health challenges. And also today we know that by promoting international cooperation, coordination is necessary to prevent, detect, and respond to global health threats. Next one, please. And one of the major opportunity, I would emphasize, I would underline opportunity. The health diplomacy has got an opportunity to promote health equity globally. And it is by addressing the social determinants and structural determinants of health. And it's about advocating for the fair and equitable access to healthcare resources and supporting efforts to achieve and attain universal healthcare coverage, not only at the national level, at the global level. There are many mechanisms in which global institutions and global agencies are impacting on the national level. So this is one of the major concerns of global health diplomacy. Next one. And again, when we look at the transnational global health context, one is the variety of dangers associated with health issues have proliferated and spread around the world, and the reference is given. And again, let me look at what are these transnational challenges. One is infectious disease like such as HIV, AIDS, SARS, avian flu, influenza, and these are some of the immediately known examples of transnational public health challenges. And increasingly, the spread of chronic non-communicable disease are linked with unhealthy products, tobacco, alcohol, illicit drugs, ultra-processed industrial food, but these are all national boundaries. These particular products are not within the national boundaries. It are often produced by transnational corporations. So deal with such transnational corporation, you have to go beyond the national boundaries, and you have to look at institutions and mechanisms to impact and influence these variables or these determinants from a global level. That's another area and the relevance of a global health diplomacy. So the tools we have to deal with the influence these transnational corporations are coming through the global health diplomacy. And also we know that the effect of pollution and environmental changes, drug-resistant pathogens, for example, multi-drug resistant tuberculosis, and most importantly, expressional rise in violence, war, and frequency of natural calamities. When you look at transnational, violence is becoming transnational, war is becoming an important public health calamity, public health, I would say public health disaster, and also frequency of the natural calamities, which often go beyond the national boundaries, or we need understanding and data from a transnational boundaries. So these are some of the major impetus, major reason, major, the engine for looking at or utilizing global health diplomacy institutions and approaches. Next one, please. And again, the structural vulnerability, the vulnerability of the population, the vulnerability of people who are excluded, that's also becoming transnational, that also becoming beyond national boundaries. We know that the begin with the dehumanizing poverty and it's impacting on health. This is not only one country, there are many countries are experiencing extremely dehumanizing poverty. Even though globally we know that there are changes and reduction and the qualitative change in the poverty, but poverty is an important public health challenge that still remaining. Even within the national boundaries of the developed countries, the impact of poverty on health is very evident and the data is adequate. There is a lot of data to substantiate this argument. And the lack of access to decent accommodation and the health goods and health services. This is also a structural vulnerability often goes beyond the national boundaries. And again, there are historical intergenerational deprivation. And many generations are being deprived, and that intergenerational deprivation is still continuing in many countries within the country and the transnational level. And the inequities, particular health inequities, the nuances, the modalities, the methods are becoming more complex and it's becoming more nuanced. And to address this, we need expertise, data, and know-how from a transnational level. And also the contemporary globalization process. The globalization process, one of the biggest challenges is the lack of a governance system to deal with transnational globalization. Because within the national boundaries, we have mechanism, legal mechanism, political mechanism to keep the decision makers accountable. But at the same time, the globalization process